The Institute for Global Health Sciences grew from the simple idea that advances in science and in health should be accessible to people no matter where they live, whether that's in rural United States or it's in a low middle income country on the African continent. It's the framework of health equity. And throughout the past 25 years, the Institute for Global Health Sciences has been the engine that tries to drive that forward.
Science sees no boundaries. Human health sees no boundaries.
No matter what school or field you're in, we're all focused on the same thing, to go ahead and help the world live better.
Our mission statement is advancing health worldwide, and our global health science program, started by Haile Debas, one of my absolute heroes, preceded that mission statement, and I think inspired that mission statement. He understood that we were a powerhouse in medical discovery and in clinical care, and he really challenged us to think big.
When Haile started talking about his vision for global health, I think that then allowed us to see that we had not only an obligation to care for our communities here in the Bay Area and California, but we had a greater obligation to care for the world.
Global health is critical in the way the world will have to respond if we have a pandemic. Every university has the obligation to do global health.
The HIV pandemic here in the early 80s was a galvanizing event for UCSF. It became a pandemic that created a generation of leaders who understood the key role of science in overcoming public health problems.
The HIV epidemic, we were ground zero in San Francisco. And Ward 86, the inpatient unit 5A, which was started by a bunch of nurses who brought together a unit to provide HIV-focused care. And when this whole thing sort of exploded globally, naturally, the people who were working in that field, of course, wanted to share their expertise.
The HIV crisis was the moment where UCSF led by partnering research, clinical care, and community partnerships. And that combination is the best way to intervene on a health crisis. Same thing happened during the pandemic. So that framework is very much embedded in our DNA. It's an interdisciplinary exploration that brings research, education, clinical care, and community together to deliver the advances that come through, discovery.
The words Institute of Global Health Sciences were very carefully selected because it was harnessing the scientific machine of UCSF to bring discoveries into the field of global health. How can we diagnose diseases like malaria using incredibly modern, hard-hitting tools?
We're working in more than 80 countries across a multitude of disease domains. It's a linkage of discovery through to delivery with implementation. And that is, I think, what's driving the reputation of UCSF.
Global health sciences cuts across all the schools and is identifiably important to the top leadership of the university.
You have a cabinet-level institute where people are really excited to collaborate across schools in order to look at issues that are related to worldwide health.
One of the most valuable things about global health sciences is that they already have the framework to make an impact worldwide. So whatever the health problem we want to focus on, they can use their network globally to help us answer those questions.
Pharmacy is a global profession, and so my faculty are very concerned with developing drugs that are accessible to everyone. And by having such an institute, it connects us to world populations, to research to teaching opportunities, and to really supporting the role of our healthcare professionals in global activities.
One of the aspects about global health is that it is an interconnected ecosystem. There's no way we can develop some of the vaccines we need for some of the most deadly pathogens in the world without being connected internationally.
And at UCSF, we've emphasized that our job is not just here at the university, but to actually make our advances known to everybody throughout the world. And we have emphasized collaboration.
What I've been most proud about of the Institute is its ability to move with the times to much, much more of a partnership model where we're learning from each other to build capacity in country. And if we can achieve that for the next 25 years, I'll be super happy.
Haile set a very clear vision that is still enduring. And it was that UCSF's excellence in clinical care, in science, in education, training, mentorship must be applied to health equity. That vision has been the vision that has led us all along the last 25 years and will continue to do so for the next 25 years. And I'm very excited about its future.